Ladies and gentlemen, we now have the guest address by the management consultant, engineer Mangala Yapa.
Very good evening, ladies and gentlemen. At the outset, let me congratulate Dr. Kaushalya Perera for the efforts, actually untiring effort that she has taken towards educating the public on health matters, which has culminated today with two launches. One is the launch of the book, The Silent Killer, and the other is the much needed health education platform, Explore Health. Well, I'm speaking here today as a patient of Dr. Kaushalya Perera. I would like to get into that shoes and speak. First and foremost, I don't want to be called a patient because I don't think I'm sick. She is helping me to manage certain health conditions, some abnormal health conditions that I have developed. For me, it is a management process. She's a specialist, and I am the party who takes advices from her and try to manage myself. And with experience from all the private sector healthcare providers in Sri Lanka, almost all, I think I have fair amount of understanding in this regard. Now, may I pose a question? There are many doctors, healthcare specialists, other dignitaries, distinguished guests. Are you truly happy about what is happening out there in the private sector healthcare system? We are a nation that cares for well-being of everyone. We have achieved many accolades. Many non-communicable diseases have been eradicated from Sri Lanka. Even very recently, WHO congratulated us on elimination of measles and rubella. Became one of the two countries in Southeast Asian region that has been able to do that when we are targeted for 2023 way in advance. But can we be happy about our particularly private sector healthcare system, which is quite popular in Colombo? Are you happy? Let me be blunt. What I'm going to tell is not going to be very sweet. It is distasteful. But as a customer, I'm not satisfied. I am disgruntled. I always argue, question, fight, write letters, and create many problems when I go to a hospital. So much so that my wife, who is a medical professional, a doctor, is most reluctant to accompany me to a hospital. That's true. That's the real status. Now, in business, Kishu and others, Nalin would agree with me, everything has to be customer focused. So, I don't want to call myself a patient, but would like to call myself a customer. Is our healthcare system customer focused? I suggest, if you don't believe me, please go and take treatment from any of these services. Then you would see that it is not customer-centric. Many businesses to grow, to sustain, talks about USPs, unique selling propositions, which differentiates product or a service offered by a professional or an institution with another. May I ask, what is the USP of any of these institutions? We may have some improved infrastructure, brought in a lot of technology, highly qualified medical professionals, lot of tests, high cost, but at the end, we are in a bit of a mess. Let's realize that situation. I think Dr. Kaushalya's effort need to be evaluated, need to be looked at in this backdrop. For me, this is a big leap forward. As Kishu said, had this been there 20 years ago, life for many would have been different. But let's move forward. Let me congratulate her once again for what she has done and invite all others to follow suit. I painted a very bad picture. Now, I am shifting a bit from that to a different side of me. While I am a customer of the healthcare system, I am also well experienced in my management. If the management or the professional managers has a problem, a bad situation, that's an opportunity. So naturally, this is a fantastic opportunity for many of you. Imagine where Sri Lanka could be if this kind of blurred, not so nice picture can be changed into something completely different. Over the next 5 years, or the next 10 years, I may not necessarily live to see that. Hopefully, yes, with Kaushalya's help. But nevertheless, it is going to be a fantastic place to live. The opportunities are in abundance to improve services. So as a manager, in my complex business management processes that I used to work, I coined my own approach. I used to call this the 3P approach. Many of the management personnel here, particularly marketing, would certainly relate Philip Kotler's the 3P, which extended to the 4P and then 7Ps. I'm not talking about those Ps. That stands for product, price, place, promotion, etc. The 3Ps I'm talking are people, process, and the product. We need to benchmark. If the private sector is benchmarking with the public sector institutions, I think we are taking it wrong. If you benchmark it another healthcare system in Singapore or in a developed country, and that's where the challenge, that's where the opportunity is. So the people can be educated, both the caregivers, health professionals, and the patients or the customers, and the processes can be improved, and then our product, that what we are delivering, will be fantastic. Let me again wish Kaushalya all success. Now, apart from being my doctor, she has also become a friend, so I can WhatsApp her various messages, we can discuss some other matters in life, etc. Let her wish, and also invite each one of the medical professionals here to take this as a challenge and take it forward. I did not intend at all to hurt your feelings and make this evening somewhat uncomfortable, but we must face reality. Thank you very much. Enjoy the evening.
Thank you, sir. Thank you very much for your thought-provoking message. Following the hotel guidelines and the procedures, and here we are. We have a set of consultants, physicians, surgeons, prolific experts. The press has joined us here this evening. We have directors of channels, plus friends of the media and very, very renowned leaders who have joined us here for a very special evening for Sri Lanka's first health educator platform. But when you have a health educator platform, that creates a relationship with your client or the patient and the doctor. And this is where we have come out with the important essence of educating the public on how you have to know about your health. Has taken great initiative in a step-by-step process of launching this. Ladies and gentlemen, she deserves a well-rounded applause. She holds a MSc in diabetes with a distinction and a certified coach, CMA Singapore, founder and CEO of Explore Health and non-communicable disease coach for Women Empowered Global. The founder and ladies and gentlemen and your host this evening. Please give a round of applause to Dr. Kaushalya Pereira.
It is our firm conviction that the Explore Health would become a great source to cover the knowledge gaps in the space of health, since it is a dire need in the country relating both to the communicable diseases and non-communicable diseases. Despite all the hard work and efforts made by the healthcare professionals, are we yielding the fruitful outcomes in the space of health? So from the patient's or client's perspective, whenever he gets sick, it is his right to know about his disease. When he or she comes to you, he would expect you to explain everything about the disease. As far as the obstacles are concerned, one is doctor-patient ratio. The other one is my busy life. So from the patient's aspect, if we ask them to come for seminars or health education, I don't think that everybody would show up. To overcome this battle, at doctor's convenience, at his capacity, he can easily give a brief explanation of the condition to the client or the patient. Examination, procedures, and treatment can be carried out at that moment. So it's your duty to record, as doctors, to record all the vital informations and feed the website. And then it is their duty, it is your duty as a public, go home and go through that particular doctor's photograph and to get to know everything about your disease, starting from the disease, how you got it, and where the organ is situated in your body, and whether you would get it again, whether you would need to go for surgeries, and what is the surgical procedure. And for instance, if you are to go for CT contrast, so the whole procedure will be there fed in the website. So you will be very well prepared when you are going to the hospital. Even when you are going for an angiogram, you would know about angiogram before you go for the procedure.
Sri Lanka's first health educated platform. I thank Kaushalya, the CEO and the brain heart Explore Health, for this very generous introduction. While we are quite happy to be cured of our illness, at times we would have wondered about what was going on in our body. We would have wondered why things are being done to us, and would have wanted to know, why have we been asked to do certain things or take certain medicines? Many times, we would do as we are asked by our doctors, without really knowing why, and of course, without our curiosity being fully satisfied. But we are human beings, and therefore, we need to know. And out of all the things we encounter, the body and the diseases remains the biggest mystery, simply because we can't see it, we can't hold it, we do not really know what's going on. That knowledge about one's body or illnesses are important to understand what is happening in sickness, but more importantly, so that we know why we have been asked to do something and what is expected of it. This knowledge empowers us and allows us to play an active role in the management of our disease. Kaushalya took her passion in health education and her ability to communicate effectively to the next level. And I'm proud and honored to be part of your moment today. Congratulations, Kaushalya. That's one of the best presents I've ever had in my professional career. Thank you so much for giving me this opportunity. Ladies and gentlemen, thank you very much. Have a pleasant evening.
Ladies and gentlemen, the launch of Explore Health, Sri Lanka's first health educator platform. Ladies and gentlemen, you can browse it through www.explorehealth.lk. Put your hands together, ladies and gentlemen. The platform is live now.
මේ වෙබ් එක ගැන පුංචි හඳුන්වාදීමක් කරන්න කැමතියි. මේකේ අන්තර්ගතය පිළිබඳව පොඩ්ඩක් මේක ඇතුළට එබිලා බලමු. දැන් මේ explorehealth.lk වෙබ් අඩවියට ගියාම වැදගත්ම දේ තමයි ඉස්සල්ලා අපි බොහෝ දෙනෙක් අතෙන් කතා බහ වෙච්ච දේ තමයි සිංහල සහ දමිළ මාධ්‍යයෙන් නිවැරදි තොරතුරු නැහැ කියන එක. ඉංග්‍රීසි මාධ්‍යයෙන් තියෙනවා, හැබැයි ඒ තොරතුරු තියෙන්නේ කොහේ හරි රටක කොහේ හරි කෙනෙක් කියපු දේවල්. ඒව අපිට කොයිතරම් අදාළයිද කියන එක ලොකු ප්‍රශ්නයක් තියෙනවා. ඒ නිසා අපිට මේකේදී භාෂාව තෝරගන්න පුළුවන්. අපිට සිංහල වෙබ් අඩවියේ මුල් පිටුවට අපිට යන්න හැකියාවක් තියෙනවා. පල්ලෙහාට ගියාම ඔබට භාෂා තුනෙන් අපි හිතමු අපි සිංහල භාෂාවේ වෙබ් අඩවිය තෝරාගත්තා කියලා. ඉතින් එහෙම තෝරාගත්තට පස්සේ උඩින්ම බැලුවොත් එම අපිට පේනවා මේකේ කාරණා කීපයක් තියෙනවා. දේශන සහ උපදේශන. යම්කිසි විදියකින් අධ්‍යාපනය ලබන්න, යමක් ගැන අධ්‍යයනයක් ලබන්න කැමති කෙනෙකුට ඒ ඔස්සේ ගිහිල්ලා අපි එතන ක්ලික් කරොත් අපිට පේනවා. ලකි අපි ක්ලික් කරමු. දේශන සහ උපදේශන ASCII බැලුවාම වෛද්‍යවරුන් ඉන්නවා. වෛද්‍යවරයන්ගේ නම්, ඔවුන්ගේ තොරතුරු සටහන් වෙලා තිබෙනවා. ඔවුන්ගේ සුදුසුකම්, අධ්‍යාපන සුදුසුකම්, වෘත්තීමය සුදුසුකම් සටහන් වෙලා තිබෙනවා. ඒ වගේම ඔබට අයිකන්ස් දෙකක් පේනවා, lectures and consult. මේ lectures කියන එක අපි ක්ලික් කරොත් එහෙම අපි වෛද්‍යවරයෙක්ගේ අපි lectures කියන එක අපි ක්ලික් කරොත් ඊට අදාළ වීඩියෝ එකක් අපිට බලන්න පුළුවන් වෙනවා. මේ ડોક્ટર සුරංගගේ ඒකට අදාළ වීඩියෝස් තියෙනවා. ඒ කියන්නේ මොන විෂයක් යටතේද ඔහු කතා බහ කරන්නේ. මේ අපි හිතමු ડોક્ટર සුරංගගේ රෝගියෙක් මේ වෙබ්සයිට් එකට ඇවිල්ලා මේ වීඩියෝ එක බැලුවොත්, නැත්නම් ඒකේ තියෙන වීඩියෝ එකක් බැලුවොත් ඔහුට ඔහු පිළිබඳ තොරතුරු ලබා ගන්න පුළුවන්. ඒ වගේම රීඩ් කියලා අයිකන් එකක් තියෙනවා. තව අපස්සේ අපි පෙන්නන්න. එතෙන්ට ගියොත් එහෙම මේ සම්බන්ධව ලියවිලා තියෙන ආටිකල්ස් ඕන දෙයක් ඔබට බලන්න හැකියාවක් තියෙනවා. ඒත් එක්කමයි කන්සල්ට් ගියොත් එහෙම ඒක ඇප් එක එනකල් තාම ඇක්ටිව් වෙන්නේ නැහැ. මොකද ඊට පස්සේ වෛද්‍යවරයාව හමු වෙන්න කන්සල්ට් කරන්නත් ඒ ඔස්සේ හැකියාවක් ලබා දීලා තියෙනවා. හොඳයි. අපි දැන් යමු නිකන් අපි ડોક્ટર කෞශල්‍යකේකට ගිහිල්ලා බලමු. පහුගිය කාලේ රූපවාහිනිය ඔස්සේ සමාජ මාධ්‍ය හරහා ගිහිල්ලා සෑහෙන විප්ලවයක් සමාජය තුළ කරන්න හැකියාවක් ලබාගත්ත කෙනෙක්. දැන් මේ වගේ ගියොත් එහෙම බලවත් විශාල වීඩියෝ සංඛ්‍යාවක් තියෙන අය රූපවාහිනී වැඩසටහන් වල කරපු දේවල්, ඒ වගේම විවිධ පටිගත කිරීම් ඔස්සේ කරපු දේවල්, knowledge first ඔස්සේ කරපු දේවල්, මේ වගේ සෑහෙන ප්‍රමාණයක් තියෙනවා. අපි රීඩ් ක්ලික් කරොත් අපිට පෙනේවි කොයි වගේ දේවල් ලියා තිබෙනවාද කියන එක පිළිබඳව, දියවැඩියාව පිළිබඳ ආදී වශයෙන්. ඒ වගේමයි මේක තවදුරටත් දියුණු කරලා ලංකාවේ වෛද්‍යවරුන් 2500කට පමණ මේ වෙබ් අඩවිය තුල ඉඩහසර සකස් කර දෙන්නට මේ කණ්ඩායම සූදානම් වෙලා ඉන්නවා. ඒ වගේම ඊට අමතරව ඔබට හැකියාවක් තියෙනවා රෝග පිළිබඳව අපිට දෙවෙනි අයිකන් එක බැලුවොත් අපිට පේනවා රෝග පිළිබඳව තොරතුරු දැනුම ලබා ගන්න ඕනම කෙනෙකුට හැකියාවක් තිබෙනවා.
Now, Kaushi asked me to speak on corporate health, and that's exactly what I thought I'll do. The Explore Health is a very good introduction, especially it should be taken to the corporates and shown how important it is, because the doctor-patient interaction right now, if you look at that platform, it is more quantitative. The doctor will tell you, take this tablet, this tablet, this tablet, and you have a list of tablets and you know the quantity of the tablets you take. You go to the pharmacy, take the tablets. Then the doctor will give you a set of tests to take, full blood count and this count, renal, and all of that. And you go and take those tests. And what you get as a result? Quantitative. It tells your blood pressure is this number. Your FBS is this number. So it's quantitative. But there are also situations where it's qualitative, where the representatives of the medical profession do spend time explaining to the patient, drawing diagrams, helping the patient to understand what this cause and what it really is and why the medicine is given and what are the active ingredients of that, what is given, the potency of that and how it reacts. To give you that qualitative interaction with the doctor. Because when a patient is ill, when the doctor speaks to the patient, it itself is a soothing, healing process. The confidence and the craft of wellness is based on the courtesy, politeness, and the in-depth interest the doctor takes in the patient. So this is a fantastic proposition. And I'm sure the doctors that have been listed on this, the professors, the surgeons listed on this list, will only be too delighted to get into that interface of the physician-patient. And if you present this in easy to absorb manner, encapsulated in easy to digest form, the corporates would definitely open their arms and would like to register with you or whatever form of interactions you plan for the corporate so they can engage with you. And you make a healthy society and you create a healthy community. Thank you.
I've been reflecting on what has already been downloaded, already being said. And I thought to myself, if this was launched in Sri Lanka 20 years ago, we would have had a much stronger economy. We've gathered here this evening at a time when the world is grappling with, I'm convinced that the digital platform contains the contents that are right for our country. So congratulations, Dr. Kaushalya, for coming up with this excellent idea. You're not just a doctor. There is a very strong marketeer, brand communication professional in you. And during Professor's presentation, she talked about the journey you're being on so far. And seeing what we have done today, I can imagine where you will take the country from where it is today with your capability, your capacity, your competence. And there is a large fraternity of doctors who have attended this nice engagement this evening. And from our side, as corporates, we will certainly give it the due publicity to make this part of our culture. And with that, I'm sure we'll be able to have the fittest workforce for the country to be able to achieve economic independence.
One is the launch of the book, The Silent Killer, and the other is the much needed health education platform, Explore Health. Well, I'm speaking here today. 20 years ago, life for many would have been different. But let's move forward. Let me congratulate her once again for what she has done and invite all others to follow suit.
So in that sense, I think what Kaushal has started is really bridging the gap. So earlier I told my patients, don't go to the internet, don't Google it, but yes, now I have a place to tell that if you have an issue, that there are things in this on different things produced by experienced and learned people, not only book knowledge, with a lot of experience, and then go for that.
Wonderful initiative, I think, in my personal opinion, and for inviting me here today. Diabetes and patient education. I think it's a very important aspect when you consider diabetes and other non-communicable diseases, that the patient education go hand in hand with the medications that we give. Like the previous speaker spoke before, just giving a pill for a ill won't do in our system. Then, of course, later in life, if you neglect yourself, definitely when the kidney problems come up and the heart problems come up, you will become a patient. So we have a stage where you have a customer with a minute health issue, which we can sort out very easily through a thing like Explore Health or a proper health education. And the main thing is what Kaushala has done very well, and I have experience with handling my patients at the Hemas Hospital in the diabetes clinic, inspiring them. It's a very good initiative, and hopefully we also can sort of learn new things and how to interact with our patients. In fact, I'm getting new ideas on how to use this very effectively for my patients. I do a series of lectures and then give them the link so that they could go through that and see. And a small advice to you, Kaushalya. When you do things, I think somebody else also mentioned, having lectured people all around the country during my tenure as the College of Endocrinologists, the president, I think with all that, it will be a very big asset for all of us, especially people who are managing non-communicable diseases. And you may start for the COVID also simple measures which can prevent deaths in our community now as things stand today. So without taking much of your time, let me again wish you all the very best with this innovative step that you have taken, and wish the Explore Health team all the very best for all your future endeavors. Thank you very much.
To say, we have to tell the people how to identify a stroke and to come as fast as possible. The next message is this. Sometimes, this was told to me by a person, anyway, this is a story I told everywhere. He has gone to the boutique in the morning at 7:30. It's a mini stroke, or we call it a transient ischemic attack. So they say, yeah, okay, vatayak, ammak, hiriyak, that type of thing. Got better. But the danger is this. That's the yellow light, the warning sign. Next time he'll get a big stroke. So we are pushing people, whether you had a transient thing or a lasting thing, to come back to the hospital and take treatment. So like this, we are going to put forward many things on this, and it will be a lot of help to the people, and how to educate the people, how to detect things and come back to hospitals and take their treatment. So in a scenario, what I have explained to you, what we are telling is don't go to your doctor, GP, general practitioner, family physician, because that's a waste of time to rush to the hospital. So these messages will be there. And thank you so much, Dr. Kaushalya, initiating this. Thank you so much for listening. Have a nice day. Thank you.
How she's using those words quite well, and she's trying to change the world, and she's trying to change Sri Lanka, and I think it's an excellent initiative and something that the country direly needed. So I was asked to speak about health education. Why is it important from cardiac diseases, cardiovascular diseases as we call it. So how could health education help as far as cardiovascular disease is concerned? It's quite easy. If people know about a disease, the knowledge, and they're empowered about what's going on with their own body, it's easy for us to help them as well. So I believe that health education from cardiovascular disease point of view can be broken into three different categories. Basically, firstly, how to prevent these from happening in the first place. We call it risk factor modification. There are certain risk factors that patients could get these cardiac problems, heart attacks from. And if the patients know these risk factors and how to modify them, it'll be easy from our point of view as well as to how best to treat them. The second aspect is how do you educate them as far as treating the condition itself is concerned. What tablets that they need to take and how much they need to take. The third one is basically how to prevent this problem, this heart attack or some sort of a complication. How do we prevent it from occurring again, recurrences? So those three factors as far as cardiovascular diseases are concerned are vitally important as far as our management, and I think that word was used previously as well. It's not about treating patients or treating people, it's about managing, and the management part of it includes this education part. And by doing this, I think we can definitely try to at least reduce the number of patients who die from these cardiac diseases. I'm not going to talk too long, to be honest, because I think everybody has basically mentioned whatever I have to say as well, because all of these issues, all of these cardiac problems, diabetes, strokes, everything falls under the category of what we call non-communicable. That means that these are not infectious. So these require a team effort, and it requires not only cardiologists, it requires neurologists, endocrinologists, physicians, everybody to work as a team. And that's what I think Explore Health is. And it's a team effort. You could see all the specialists who are involved in taking time off their schedules to make videos for patients to come and listen. And I believe this is a great initiative, and I congratulate Kaushi again for a wonderful initiative.